So welcome everyone. I'm so excited and overwhelmed to see how many people are finding this topic interesting. So we have 126 individuals who registered, and I'm so excited, actually beyond excited, to say the least, because I did not expect so many people. So let's make the best of this. Let's get started. So thank you so much for joining me today. My name is Joyce Faraj-Ardura, and I am a nutrition counseling coach. And as a nutrition counseling coach, I have spent quite a bit of time talking with dietitians, just getting to know what the biggest struggles they're facing in their day-to-day practice. And this is a topic that comes up again and again. So I figure, why not make it into a masterclass and share what I've learned throughout the years. So, hi everyone. This is a fancy picture I took this summer. So I'm Joyce. I am a nutrition counseling coach. I am also an assistant professor of nutrition and dietetics, and I teach nutrition counseling to seniors as well as graduate students at Framingham State University. And I founded the Nutrition Counseling Academy about a year ago. I specialize in motivational interviewing as well as behavior change science, and I try to focus on patient-centered, strength-based, solution-focused strategies to support a patient's behavior change journey. And we all know that there is a lot to learn in this area. So let's dive into it. By the end of today's masterclass, you will be able to identify some of the key requirements for behavior change. Actually, it's 6. I added one more today. You're going to be able to at least know what things to keep an eye out when you're assessing how your clients are doing with respect to those 6 key issues that can get in the way of behavior change, and then choose an appropriate strategy to support your clients when they're struggling. So first things first, are you in the right place? Is this masterclass for you? Have you ever felt imposter feelings or feeling inadequate because you should know how to provide effective nutrition counseling? I've been there. So go ahead and say yes, use the chat if you feel like any of these things are things that resonate with you at any moment throughout today's masterclass. This masterclass is right for you if you want to provide the best client experience and you care deeply for your clients and your patients, but you feel guilty that you're not really helping them make the progress that they wish or you wish that they were making. You have an innate ability to connect with people. You love being able to connect with people, but yet you aren't sure how to make your clients move in the direction of behavior change without being pushy. Your nutrition counseling sessions often leave you feeling drained and unfulfilled as an RD, and this can often lead to burnout. And lastly, is this masterclass for you? It is for you if you feel that something is missing in your training, and therefore you cannot make the impact that you wish you could make on your clients' lives. Because you're here, I know that you are a great professional who cares deeply about helping your clients. So how can we make the best of the work that we do with our clients to really move them in the direction of lasting behavior change? You're in the right place if any of those things resonated. Now, this masterclass is not for you if you actually enjoy feeling stuck in your nutrition counseling sessions. Not me. It was terrible. This is not for you if you like to take on the heavy burden of responsibility for your clients' behavior change. I've been there. Working more than your clients, caring more than your clients. That's not the way it should go. This is not for you if you feel that providing nutrition education is the best, potentially the only way to approach your sessions. Nutrition education is a part of the intervention, but it should not be the whole intervention. This is not for you if you see the role of a dietitian as someone who just gives information and fixes people. We don't do either. Well, yeah, we do give information when we have to, but we are not there to fix people. This is not for you if you prefer a top-down prescriptive approach or if you want to be considered the only expert in the session. And lastly, this is not for you if you actually feel totally confident and you don't feel the need to level up your nutrition counseling skills. So then let's get into it. I like to ask you, what is the hardest or most challenging part of nutrition counseling in your experience? You can feel free to type it into the chat, send to everyone, or you can send it directly to me. I'd love to hear what are the things that you tend to struggle with the most. Yeah, not getting overwhelmed with all the changes I feel like they need to make. Client retention. Okay, so client leaving before they're ready to be on their own nutrition-wise. What else? What other nutrition counseling struggles or communication struggles have you faced with your clients? Getting through barriers to change, knowing if I'm doing it right. Yeah, always questioning, is this the right place? Is this the right approach? The worry of not having all of the answers to their questions. That happens to all of us. Let me just say that it's okay to not have all of the answers. We're just human. Helping them find the confidence to really work at making changes. Okay. Clear roadmap to goals. Being culturally equipped to provide patient-centered care. Love it. Giving clients their money's worth with my programs. Like, am I providing enough value? What are my clients thinking? Absolutely. Gently keeping the client focused. Okay, yes, those all sound like things that I have also gone through at some point. So thank you for sharing. I'll just say that you're not alone. Probably many of the other people who are here that did not speak up or that are watching the replay also feel a similar way. So you're not alone in this journey. So then, does this resonate? Have you ever thought about this? If I could have a magic wand and have all my clients be motivated, how awesome would that be? So because we're taught to provide nutrition education, that really is going to be an effective intervention if clients are ready to receive nutrition education or if lack of nutrition knowledge is the main issue. However, those individuals who come to us ready and motivated and just want to learn and they're ready to implement, those are unicorns. And even if they have high motivation, motivation tends to wave. So you have low motivation, then high, then low, and it's going to be essential to know how to assess this and what the best strategy might be to keep our clients moving forward. Dealing with clients who are not ready to change is challenging. I mean, if you have a client who's ambivalent, who is in the contemplation stage of change, they're not quite ready, maybe they see they have a problem, maybe they don't even recognize they have a problem. Those are tricky clients, yet we are taught through our training to be pretty effective at helping clients who are, preparation or action stage. But what happens when they are actually before that in their readiness to change? What if they're in the pre-contemplation or contemplation? What do we do then? Nutrition education is not going to solve it. So what strategies can we implement? Third one, I wish I could make a bigger impact on my clients' lives. You wish you could help everyone, but not everyone will need the help that you've been trained to give. And the last one is, I just don't know how to approach clients who are struggling. And that's what this masterclass is about. So because it's not a matter of whether they're going to struggle or not, it's a matter of when they're going to struggle. Everybody's going to struggle. Everybody has barriers. Everybody has, a life that can get in the way, and then health takes a back seat. So then how do we approach these clients when they're struggling and we are equipped with nutrition education? What else can we do? We need to be able to own some of these communication and behavior change tactics to be able to support them through this journey. So I'm here to tell you that if you feel that something's missing and any of the things resonate, it's not your fault. So although the Academy of Nutrition and Dietetics recommends that dietitians incorporate proven counseling methods, such as motivational interviewing, to help clients facilitate desired behavior change, we're not always given enough opportunity to learn, practice, and master those skills in our training. I'd love to hear from you at this point. What training did you have before you became a dietitian? Was it a semester-long training, in a nutrition counseling class? Was it maybe just a couple of weeks? Maybe it was a couple of, day-long workshops. So, or maybe none. Thank you for sharing. So it's really sad, but it's true. And it's happened to most of us. So we are expected to help our clients and support them through behavior change, and yet behavior change science and our training does not really involve too much of this. So then, where are we left? 9 out of 10 dietitians, after they become credentialed, feel that they need additional training to be able to feel confident in their ability to support their clients through behavior change. So that's 9 out of 10. It's most of us, right? 90% of us. So dietitians systematically are going to assess, diagnose nutrition problems. We're going to come up with interventions, monitor, evaluate, the ADIME of the nutrition care process. And in reality, we consider, or the Academy considers, nutrition counseling as being one of the interventions, just like nutrition education is. But to me, nutrition counseling goes beyond just an intervention, because it's what's going to really build the foundations for a good, strong therapeutic relationship. And that's going to be the number one predictor of how long your clients stay working with you. That's going to be the number one predictor of positive client outcomes. This is basically it's mostly from psychology research, but it applies to nutrition as well. So how we communicate with our clients and how we're able to support them through their behavior change journey is going to dictate how long they work with us. And the longer they work with us, the more likely we are to help them create and sustain longer term habits, so that ultimately they're going to be able to be your walking billboards. They're going to give you good testimonials. You're going to feel better about your ability to help people if you're able to retain them long enough to make these changes. So the nutrition counseling to me goes beyond just an intervention. It is the foundation of how we deal with clients and what we do with clients to support them in behavior change. So foremost, our current training leaves much to be desired when it comes to nutrition counseling to support behavior change. If you had a class, some of you mentioned you had a couple of assignments and that was it, maybe one lesson on motivational interviewing. So it's not your fault. Most of the training, because it encompasses so many topics, it kind of pushes nutrition counseling and behavior change science and the psychology behind eating behavior, and it minimizes this to a couple of classes. It gives it a heavy emphasis on nutrition education, not counseling itself. So this leaves dietitians feeling like they lack the confidence and they're unsure how to proceed when clients need more than just education. And reading a book on motivational interviewing, although it can be really great and a great resource, it can give you the knowledge, it's really not going to be enough for you to be able to apply it, implement it, get feedback, and really master it to a point where you feel like, okay, you're doing things well. Even motivational interviewing is meant to be learned with a mentor. Same thing with most counseling modalities. So it's meant to be taught and learned with a mentor so you can apply it and get feedback. And that's really how you're going to master a lot of these skills. So what you have done up until now, your training, that wasn't your fault. But what you do about it now moving forward is up to you. And you're all here because you want to take charge of your professional development and you want to enhance your communication skills, your counseling skills, so that you're actively seeking ways to improve because you know how important it is. So before we shift into behavior change science, I would like to ask you, if we had an ideal situation, and I know everybody's different, how much time would you ideally want to work with clients to support them through the maintenance phase until they're like ready to fly on their own nutrition wise? Is it a couple of months? Is it a couple of weeks? What are you thinking? Okay, so I have someone saying 6 months, probably. Any other volunteers? Just think of your most successful clients, particularly those who have been working in outpatient settings, Your most successful clients, how long have you been working with them? Lifelong, yes. So it's important to think of dietitians as someone who's in it for the long haul, right? To be there to support your clients through long-lasting behavior change. Because even when someone is in maintenance, they still need a lot of our support. Things are still going to pop up. They have to be able to identify what's going on, identify triggers for potential relapse into older habits. They still need our support, even if it's in maintenance. Okay, 3 to 4 months, quarterly. Okay, wonderful. So ideally, we want to work with clients long enough until they feel like they can just fly on their own, and they're on their own and they don't need us anymore. But always leave the door open in case they do need to come back and see us. For some, it might take 3 months, 6 months, a year. So it's really going to vary depending on where the individual is. And it's also going to depend on how we tackle the situations. So when we consider our training and our ability to keep clients, we have to think about how can this affect us doing our job of helping our clients. So the Academy of Nutrition Dietetics recommends about 6 months of nutrition counseling to truly make a lasting impact in our clients' lives. And this is only taken from the publication from the Evidence Analysis Library for Weight Management. So if you see, let's say, a client on average 3 times, and you should be seeing them about 14 times to reach a maintenance phase in a 6-month period, according to the Evidence Analysis Library, that's about 11 sessions you're potentially missing. And I'm just taking some numbers on average for insurance. Let's say they give you 120 reimbursement for a session. That's potentially upwards of $1,000 of missed income because, or missed potential earnings because the client is not able to, keep on working with us. So let's say this happens with 100 clients in a year. That's upwards of $100,000 of potentially lost revenue if we're not able to build a strong relationship and keep our clients working with us long enough until they don't need us anymore. And this is not just about finances, but if you're not able to get clients to keep on coming back, and if you're not able to keep them, you truly cannot make a lasting impact on their lives. So what if instead you knew exactly how to approach clients in various stages of change? You felt more confident in your ability to create a therapeutic relationship and retain clients. You felt amazing about the impact you're able to make on your clients' lives, and you knew exactly what to do when clients felt stuck in their behavior change journey. So today we're going to focus on the last bullet point here. What to do when clients are stuck. We don't have much time. We don't have enough time to cover all of it. We're just going to be, looking at the tip of the iceberg as far as behavior change goes, but I try to pick the most common struggles and strategies, effective strategies. So the Nutrition Counseling Academy, what I created a framework that includes the foundations of behavior change science and counseling skills, application, coaching, and immediate feedback in a 12-week program, ongoing implementation and personalized support, and then discussion and troubleshooting of cases or case consults. And application of this can be applied to one-on-one, or it can also be applied to groups. This is my framework, but today I'm only going to go into some of the micro skills of application and some of the foundations, and I don't know why it's not showing, of behavior change science. So the whole framework covers all 12 of these aspects. Actually 9, I can't count. So do you find yourself struggling with any part of the process? And what would you do if you could master each part? How would you feel if you felt the confidence that you knew how to approach clients in different situations when they're struggling? So I can say for myself, it relieves some of the stress. If you know how to tackle some of these situations, feel more confident, you're going to feel better about the work that you're doing, and you're going to know you're going to provide more value to your clients. So then let me tell you a little bit about myself. I did all of my academic schooling at UMass Amherst in Western Mass, and I miss it. I want to go back eventually. So I was there for my undergrad. I did a undergrad in nutrition. I also did an undergrad in microbiology because I loved how the immune system worked and nutrition of the immune system. And then for my master's, I went into nutrition for female reproductive health as my main area. And then for my PhD, I expanded into nutrition and mental health. And that's what really got me thinking about behavior change. After my PhD, I went on to Mountainside Treatment Center. There's a substance use recovery clinic in Connecticut, where I was able to create and manage a nutrition program for this facility. And we had clients in the detox unit. We had clients who were there for maybe a week, clients who were there for 30 days, and clients who were there for 6 months and onwards. So I was able to see clients from all of these different aspects of recovery. And it was in that work that I truly discovered about all the things that I was missing as far as nutrition counseling, or just counseling in general, because I was the only dietitian there, but I was working with therapists, counselors, social workers, psychologists, psychiatrists, and I was going to all the professional development they were going to. And that's when I realized, wow, there's a lot more that I need to learn. And I also realized that we didn't get enough training on how to treat and manage eating disorders. So I started getting all of this training as well. I got training for intuitive eating. And then I decided that how I could best meet the needs of my population was from a non-diet approach, because individuals in recovery tend to have a lot of black and white thinking. So then how to get them thinking about food in a more flexible way. So after I was doing that for a couple of years, I was hired by Framingham State University, and I'm currently an assistant professor in their tenure track position in the nutrition department. And I've been teaching nutrition counseling and medical nutrition therapy for the past 4 years. And that's when I realized, no wonder we don't know enough when we graduate, because we don't get enough training. So as part of my goal working there has been to really boost all of the motivational interviewing, nutrition counseling, effective communication, inclusive counseling, cross-cultural counseling, all these things that have to do with how we talk to our clients and our patients, so that students are able to really feel more confident. And then talking to dietitians, I realized, well, I wasn't alone. Other people had a similar experience to me, and they need more support. So that's when the Nutrition Counseling Academy was born a year ago. And I started just trying to figure out how to make this work. So this is also me in the right corner, and those are my 2 daughters. I am a mom. I'm also Latina. I'm from Honduras. I've been here over 20 years. And the highlight of the past couple of months is that I presented at FNC this past year. So it was nice to see other dietitians that I've only met online and finally meet them in person. Okay, and I have this slide. So I did create the Nutrition Counseling Academy. Those of you who are not yet part of the Facebook community, I urge you to go ahead and join if you have Facebook, because I have lots of free trainings there. If you go to the guide section, I have over 20 mini trainings on different aspects of nutrition counseling. So please, by all means, search for it and join, and I would love to have you. I also have the Instagram account that's mostly for, sharing information here and there. And that's where it started. Okay, so let's dive in. Thank you for sticking with me. So let's dive into foundations of behavior change. When you see your clients appearing unmotivated, like they're not making progress, they're stuck, they're really just seeing the tip of the iceberg. We need to really assess what might be going on. So behavior change wise, what might be going on underneath the surface that's going to help us solve whatever puzzle they're going through. So the best way to approach this is by looking at the behavior change requirements for continued motivation. So issues to consider when a client is feeling stuck. These are the 6 main points I'm going to go over. I'm going to go over into the importance and how to tackle each of these. So the first one is, have the client's big reasons for change and expectations been discussed with you, the dietitian? The client needs to perceive their efforts to be worth it to achieve outcome. The client needs to believe they are able to change. Do they have the confidence and self-efficacy to do so? Where is the client regarding readiness to change? Remember the stages of change model? What are their perceived barriers? And are we overwhelming the client with information or too many goals? Or are we setting them up for failure? So regardless of which behavior change theory you pick, many of these tend to overlap with many of the behavior change theories. And you can see they can all apply to eating behavior. So to help our clients get unstuck, we need to assess where our clients are within each of these requirements for behavior change. We're going to dive into each one of these. So number one, have you, as a dietitian, gone deep into the client's goals and big reasons for change? I'm going to start off by saying that it is essential for us as dietitians to have a clear understanding of the client's goals, their why for wanting to change, and they need to know that too. They might not really know it. So if they don't have that insight, it's going to be really hard for them to keep that commitment long-term. So then how to tackle this? If you haven't already done so, you can do this at your next session. First of all, assess values and goals with genuine curiosity. Don't settle for superficial answers. So we might need to really figure out what they value in life. If they value family time and being healthy and their behaviors don't really align, then we can point that out in a compassionate way and kind of dig with curiosity, like genuine curiosity, what might be going on, with compassion as well. So they don't feel like they're being judged in any way. So having this pointed out can be a potential motivator because people want their beliefs and their actions and their goals to line up. Second one is discuss expectations at the beginning. So when it comes to discussing expectations, we really have to help them visualize what they want. And they're only going to be able to, discuss expectations at the beginning. Clients may come to us with unrealistic expectations as to what they want to get out of meeting with you, what results they're expecting to see, and in what time frame they're expecting to see this in. How many of you have had clients who have really unrealistic expectations when you're working with them? And then they get frustrated because they're not meeting their own expectations. So people tend to be really harsh on themselves. So they're their worst self-critics. And how do you manage these expectations? So are they focusing too much on the outcome? Example, weight loss or wanting to fit into, a wedding dress, or, that's an outcome. Those are things that are outside of our control. How can we have the conversation with them about the things that they can control? What is within their locus of control? Behaviors tend to be things they can control. The process is something that they can control. They cannot really control the outcome. So having that conversation is going to help them realize that it's not an overnight type of result that they're going to get. It does take time. You can always share some of your success stories with other clients that you've seen and let them know that realistically, everybody's different, but it can take around this number of months for someone who is consistent to see some progress. So they know that they're in it for the long haul and you're there to support them through that. The other thing is that when they're coming to us with these expectations, it's really common for them to be comparing themselves to maybe, how fast other people have lost weight or how fast other people have seen progress, and it's not going to be constructive. So trying to focus inward, trying to focus on the small goals, no matter how small, progress, trying to focus on any small win, no matter how small, is going to be key. So making sure that they're able to recognize that some progress, like any progress is progress. It doesn't have to be an all or nothing. It doesn't have to be like losing this amount of weight, but any progress is going to help. But you have to have that conversation with them. And then lastly, help them visualize what life would look like if they were successful. So they need to see their desired future self. If they don't have this image, if they haven't thought about it, their goals are going to be very abstract. But help them visualize, if they were successful with this goal that they want to work on, how would their life be different in 6 months? How would it be different in a year or 2 years? So they have to start seeing this and thinking about it and visualizing it so that they actually build this picture of what they desire, and it's going to help them keep some of that motivation longer. And many times when clients go to a healthcare provider, they don't ask so many questions. They don't ask questions that get them thinking so hard. So when you ask questions that get them thinking about their future and their goals and their values, give them some time to respond. Make sure you're allowing them to think about this and not just jumping into the first thing that they give you. So it's going to be an essential use of open-ended questions to really get them thinking about what they really want. Number 2, is the client perceiving their efforts to be worth it? Does the client think the outcome they're going to achieve is much better than any disadvantage that is going to cause? In other words, do the pros outweigh the cons? So once they feel the benefits outweighing the disadvantages, that scale is going to tip in the direction of behavior change. And behavior change is going to look like the most appealing option for them. So then how can we help our clients see that their efforts are going to be worth it? One would be to remind them of their big reason for change for number 1. So why is change important to them again? Remind them of that. Maybe they forgot. This guided visualization activity is really good for when someone is in the contemplation stage, when they are not quite ready for change. They know they need to change, but there's something pulling them in the direction of not changing. Maybe they're very comfortable. Maybe they have too many reasons to not want to change. This guided activity is going to help them visualize both paths. So you first start off by asking them, okay, let's say that you were to not make a change. How will your life look in 5 months, or let's say 6 months or a year? If everything stays the same, how would that look? How would that make you feel? Then you ask them the opposite. What if you were to make this change? How would your life be different? How would it be better in 6 months to a year? It's going to be really important to walk them down this path and to end with the possibility of change, so they can look at both scenarios and see which scenario is something that they want to work towards. Another option is called a decisional balance. So this decisional balance is when you come up with your client, you come up with a list of the pros and cons of staying the same versus the pros and cons of changing. So what are the advantages of each or the disadvantages of each? And when this decisional balance shifts towards having more pros of change, or maybe not necessarily more, but having the pros of behavior change outweigh the cons or disadvantages of staying the same, they might start to get concerned about not doing anything. So the trick here is that when you're asking them about the benefits of making a change, go ahead and ask them, why else? What other thing can you think of? So we're prompting them a little bit more to get them thinking about the benefits of making that change. They have to start thinking about the benefits of what they expect to see or what they would like to see by making that change. See if I covered everything here. So in my program, we go over how to ask the effective questions to really get clients thinking about their big why and thinking about, the benefits of change and getting deep with them, not being afraid to get deep with them. Number 3, does the client believe they can change their behavior? This has to do with confidence and self-efficacy. So if anyone has ever tried to change their behavior, you know how difficult it can be. And this has a lot to do with how clients perceive their own ability to make a change. It's psychology. A lot of this is the own client's perception of what can be getting in the way, their perception of how difficult things are going to be. So changes are, the chances are when a client comes to you, they might have tried a lot of things in the past. They maybe tried a lot of different restrictive dieting, or maybe they had a lot of fails or failed attempts. They might be coming to you with lower self-efficacy, lower self-confidence. Maybe they're disencouraged. Maybe they are, there are a lot of negative feelings thinking about the things they've tried and how it hasn't worked. So we have to think about ways to increase their confidence and self-efficacy so they can actually see the positive side and that they're able to make these changes with your support. So then how can we make these changes more accessible to them, should I say that? So when their perceived behavioral control is low, that is the person's confidence in their capability to perform a behavior and whether they believe they can overcome barriers and challenges. I'm also going to talk about barriers in number 5, I think. And the self-efficacy is going to relate directly to whether a person performs the desired behavior and whether it does, they don't. And self-efficacy and confidence are also big parts of many of the different behavioral theories. So then how do you tackle this? The first thing is think that if someone's coming with you with low self-confidence, low self-efficacy, we need to empower them. We need to find ways in our conversations to be able to get their spirits up. We tend to use a lot of affirmations, one of the big O's in motivational interviewing. Use affirmations to increase the client's confidence. If they've shared with you that they've been successful at something in the past, you take that affirmation and give it back to them. And my mentor said a while ago, and I really love this, affirmations are like hugs with words. So think about how good you feel when someone gives you or says an affirmation to you. Affirmations are going to be statements that are going to reflect someone's efforts, intentions, strengths, abilities, positive things, right? If you don't know a client so well, you can ask for their strengths. Ask them, what are your strengths? What has worked well for you? Tell me about a time that you were successful with this. And then you take that and you form an affirmation with it. An example can be, you've done this before, you know what it takes. The thing with affirmations is that it has to be focused on the client, not on the practitioner. So it has to be you statements. The second one is empower them with a strength-based approach. Ask them about their previous successes, identify their strengths. So empowering and using affirmations kind of go hand in hand. But affirmations can go beyond just what they tell you, also what you've been observing from what they're saying to you. If you notice that they're constantly, even trying things, even if they're not successful, that perseverance is something that should be highlighted. You're putting a lot of effort at, your perseverance is going to pay off. That's an affirmation that you can use. So think about positive terms, strengths, things that someone is doing that is going to make them feel better if it's said to them in a genuine manner. And then the other part is, what do they actually need to feel more confident in their ability? Do they need more education? Do they need more skills? Do they need more support? Do they need more training? What do they need to be able to be successful with behavior change? Number 4, does the client believe they can overcome their barriers? Perceived barriers are going to be the most significant factor in determining someone's behavior change or ability to change their behavior. It's going to be essential for dietitians to expand their assessment to also dive deep into our clients' barriers. So what are barriers? They don't have to be physical things, but they could be. So barriers or perceived barriers are a person's view of the obstacles that stand in the way of behavior change. Barriers can be tangible, like lack of transportation or financial resources, or they can be intangible, such as psychological barriers, so like fear or embarrassment or inconvenience, or having like an all or nothing mentality. So then how do you tackle barriers? Let's explore barriers. I know this sounds very simple, but in reality, everybody has barriers. We all have barriers. So if barriers are stronger than benefits, guess what? The client's not going to change. So we have to be able to have a conversation with them as you're coming up with, a plan as to what might get in the way of them being successful with that plan. Is it that they're taking on too much? Do you need to adjust the plan to make it a little bit, make it into a smaller bite-sized piece, baby steps? Is it that the plan is too big, we have to break it down, or is it other things that might be getting in the way? Maybe they might need to get some training to feel like they're more confident. So then what is going to get in the way of them meeting that goal? That's going to be the barriers. In motivational interviewing, we tend to explore barriers using confidence rulers. So at the very end, when you're coming up with a plan together, right? Because it has to be in partnership with your clients. When you're coming up with a plan together, then let's say you have come up with a plan together already. Before they leave your session, you got to ask them. So on a scale of 0 to 10, 0 being not confident at all and 10 being extremely confident, how confident do you feel that you can actually meet this goal in the next 2 weeks? Or, from now until our next session. And if they say 7 or 8, something's getting in the way. Even if they say 9, there's something getting in the way. They have something that's going to be getting in the way of them meeting that goal. What is it? You have to have the conversation with them. So then you could ask them, what would need to change or what would need to happen for you to be closer to a 10? What could possibly be getting in the way of you meeting that goal? And they're going to tell you exactly what they think might be getting in the way. So it's going to be essential to not skip that conversation when it comes to figuring out what is getting in the way. Discuss any potential unforeseen challenges as well. So if nothing gets in the way, you can ask them. So this is where I would dive into the client's potentially past failures, like what has gotten in the way in the past that you would like to talk about. So that leaves the conversation open to discussing what things went wrong in the past, but what can be done to overcome them. So it needs to be a solution-focused approach. And that's going to help the client reduce that perception of barriers as you're moving forward with behavior change. Number 5, has the client regressed to a prior stage of change? So if you think about the stages of change, I really like this little figure here. I got it from Catalyst Counseling website. So let's start with 1. And it's a little bit more complicated than this, but let's just start with 1. When the client is in pre-contemplation, they're thinking, no, not me. I don't have an issue. I don't need to change anything. They're in denial. When they are in contemplation, that means that they are aware that they might be at risk or the severity of the condition that might be at risk. And then they're thinking, well, maybe I need to change something. They're recognizing that there's room for improvement. This is when they are highly ambivalent. This is when they're in contemplation. They're being pulled from both directions, direction to not change, direction to change. Then we have preparation. Preparation is when a client's like, okay, so what do I do now? They're not quite sure what to do. They need your help, but they're ready to make a change in the next couple of weeks. Then you got action. Okay, let's do this. I'm doing it. I've been doing it for 6 months. And then you have maintenance. It is possible. I've been doing it consistently for more than 6 months. It can become a habit. That's typically the stages of change. It's very common for someone to go from maintenance back into contemplation, or to go from preparation into contemplation. So it's not always linear, and it's not always going to be moving in one direction. People can regress in a stage of change. And we have to think that relapse is when someone goes back to previous habits, or when they go back over and over again. A lapse is a one-time thing. A relapse is when they keep on going back to older habits. Relapse is the rule, not the exception when it comes to behavior change, unfortunately. So it's going to be a good opportunity for learning and for growth. What caused the relapse? What can we have what plan can we have set for next time they are able to identify a red flag or a trigger or a warning sign? What might be a solution to that? So there's going to be a conversation you can have if you're noticing that they're regressing to old behaviors and they're really getting stuck. So you have to figure out, is it motivation? Is it readiness? Where are they? So you're going to have to assess their motivation and readiness to change, and then ask them if their priorities have changed at that point and adjust the intervention accordingly. And the only way we're really going to get to that is if we have a good conversation with them, we listen to their responses, and assess how they're ready. And assess how they feel about continuing with the goals, adjusting the goals, increasing efforts, or backing down on efforts. So they're gonna let you know, but you have to ask them. Otherwise, you're not gonna know. You're not gonna be guessing. You don't have a magic ball, right? If we did, this wouldn't matter at all. We can just use our magic ball. And I am seeing some questions. I'm gonna go to the questions at the very end. Number 6, is the client feeling overwhelmed? Now, this is a very common one. And they might not necessarily tell you, but they can show you with their body language. This tends to be one of the biggest mistakes that we make. We give too much information to our clients, or we give them a goal that's way too big for them to handle. And why do we do it? Because we want to show them the value and our expertise, and we want to show them that we can solve their problems. So this also pushes us to fall into the expert trap. This means that perhaps we don't have a great understanding of behavior change science and the psychology behind behavior change, and the type of counseling communication that is needed to be able to support clients. So when you're feeling not confident that we can offer to our clients what they need, we tend to want to solve everything for them. And why is this a problem? So I have an extra slide here for this one. We want to show our clients that we have the expertise, we want to solve their problems, we want to give them as much value as possible, but giving out all the solutions or giving out too much at once can lead to, first of all, the client taking a passive role. If any of you are familiar, when we talk about the conversations we have with our clients, we want the client to be doing most of the talking. They say the rule should be that they should be talking about 70% of the time, maybe 80% of the time. That leaves us talking 20 to 30% of the time. So if you're talking too much, I just learned this acronym, which I love. It is WAIT. WAIT stands for why am I talking? So when you're talking too much, it means you're dominating the conversation, you're taking over. And when you do that, the client is going to be falling into a passive role. We want them to be an active participant in the session so that they're having this conversation with us. And they're able to, help us together to figure out what's going on and what the best way forward is going to be. The next one. When we try to give out too much, the client may not want to come back because they feel they've gotten all the information. I have been guilty of that. In the first couple of sessions, give them all the information because I want to show them how much I know. And then after session 2 or 3, the client's like, okay, I don't need you anymore. I was at that point years ago. So when they have all the information, maybe they feel like they gotten it all. Why are they going to come back? And that's a very common thought. They think they can implement it on their own, but they've likely tried this before and failed. So that's a conversation you can have with them as well. The other thing is that too much information can leave the client feeling overwhelmed, discouraged, disappointed. And then they go home and they realize they can't achieve all the things that you talked about achieving, all the goals you set in place. They're feeling that they already failed. So then why even try? Lowers their self-efficacy and lowers their self-confidence. And then imagine someone who has an all or nothing mentality. Then what this does to that individual is that it pushes feelings of failure and that they can't do it even more. So this is really setting someone up for failure if we overwhelm them. That's not to say that we have to withhold, but simply we have to provide them enough information so that they're able to successfully move forward with the goal at hand. And make sure you're assessing what they already know using elicit, provide, elicit. Ask them first. Elicit, provide, elicit from motivational interviewing. It's a way of assessing someone's knowledge, perceptions, beliefs, attitudes. So we first ask them, so tell me how much you know about the relationship between food and X condition. So then once you hear them talking, you're just there to fill in the gaps. You don't have to tell them everything you know about biochemistry of food and glucose metabolism and all these things. So Give them enough so that they feel they're equipped to move forward with the goal and the area of focus that you and the client have chosen to talk about. So then how to tackle this? First, try to not overload the client with too much information, not give all the solutions, and not give too many goals. Any of these things are going to make people freeze. When they freeze, they're not able to move forward, and they're overwhelmed. They can't really take in information and learn. They can't really think clearly. It happens to all of us, right? So whenever possible, try to put yourself in their shoes and just give them enough information to be successful for that particular conversation. Also, allow the client to pick the smallest step possible to start with. And you're going to determine whether that step is too big or not by asking them how confident they are in their ability to meet that goal. If you assess the barriers, you're not confident at all, how can we adjust this goal so that it is something that you feel confident meeting? Much rather have a client leave my session feeling very confident in one small goal, maybe two, than having them leave with less confidence for 4 or 5 things that they need to do. So you're going to have to ask them to see how they're feeling. I would opt for no more than 1 to 3 goals. I would even offer just one goal to start off with the first week, and then have them prove to you they're able to do it. Then they come back, and then you can add more things. If they were to ask for more goals, they want more, they're very ambitious, they're very motivated, fine. You can talk about additional goals, but let them know, if you're feeling that at any moment you're struggling with these 4 goals, why don't you pick the top 2 that you want to prioritize and just focus on those. And then we'll discuss next time we meet. So they know they're not going to have failed if they're not meeting all those goals. The other thing is to pick some of the goals, if possible, that have that require the least effort on their side, that might have the highest return on investment per se, so that they're going to be able to meet this goal and feel confident. That's going to raise their self-efficacy, self-confidence. That's going to empower them ultimately. So don't set them up for failure, set them up for success. Something else I wanted to say, and I don't remember what it was. Yes, this is the last one. So when you have a client who, actually I would say this to every client, let them know that they don't need to have made progress to come back and see you, because many times people are thinking, oh, I haven't done this goal, I haven't done this, I'm not going to go back to my dietitian until I've done this, right? Or it can apply to the doctor, to any healthcare professional. Let them know they don't need to have made any progress to come back, especially if they're struggling. That might be the best time for them to come back and have the conversation with you as to why they're struggling. So once they know this, some of that burden can come off of their back, and they can actually discuss what's been going on as to what has been getting in the way. And you can adjust strategies. So in summary, these are the 6 top factors that I discussed. Number 1, and I want you to think which of these, if any, resonates with you, or which one would you like to work towards. So the first one is discuss the client's big reasons for change and manage expectations. Then we have is the client perceiving their efforts to be worth it to achieve outcome. Empowering the client, so increasing their confidence and self-efficacy. Adjusting your intervention to the client's stage of change as needed. Explore and problem solve perceived barriers in depth, and do not overwhelm the client, and do not set them up for failure. I'd love to hear from you at this point. You can choose a number. Which of the 6 behavior change challenges resonated with you, or is something that you would like to focus on or learn more about? I'm just curious. Okay. Okay, I'm seeing overwhelm, seeing barriers, empowering the client. Okay. 3 to 5. Great. Okay. Thank you for sharing, everyone. So let me ask you, is there more that you could do? You work so hard to get to where you are. You work so hard to get clients. What else can you do to support them through these challenges? Is there anything you can do to truly provide the best client experience and retain them as long as they need you? So the lack of training up until now was not your fault. However, what you do about it moving forward is entirely up to you. So what if instead you knew, or you had the confidence to know you're choosing a right approach in different situations? You felt confident in your ability to create a strong therapeutic relationship with your clients. You felt good about the impact you're making when you're working with them, and you didn't stress out about holding space and guiding the session. How would these make you feel?